Okay, Aisha, it's the end of our shift, and as you know, I'm meeting with all the students to talk about how things went. So I'm going to be talking to you about patient-centered care, clinical judgment and critical thinking, professionalism and communication, time management and organization, and safety and infection control. So how do you think your shift went today?
I feel like I made a lot of mistakes, and I'm very nervous about that.
Yeah, tell me more.
Well, we talked about how I didn't notice Mrs. Reynolds getting worse.
Right, exactly. Yeah, she was deteriorating and you didn't notice.
Yes.
Anything else?
I also struggled with time management. I spent a lot of time in the patient's room, and I feel like I didn't get my documentation done before it was time to leave the unit.
Right, and you should have been able to do that. You have plenty of time. You should have been able to complete all of your tasks.
Yes. I'll do that next time. I'll try to do that next time.
Okay, I hope so. I'll be watching for that. Okay, anything else?
Well, I guess what went well was me talking to my patients. I enjoyed doing that, and Mrs. Lewis seemed very comfortable, and I liked explaining things to her.
Okay, well that's good. I'm glad you had that interaction with her, but that's part of why you weren't able to complete all of your tasks.
Okay, I'll keep that in mind next time.
Yeah, okay. And then, did you notice anything else that went wrong?
I don't think so.
You
I don't know.
You didn't notice that you didn't do hand hygiene before you went into Mr. Johnson's room and then when you left?
Oh. I guess I was too focused on getting the vitals and the assessment done, and I didn't notice that I did that until you mention it now.
Okay, well hand hygiene is super important for infection control. I mean, you could have really hurt Mr. Johnson. You could have given him some kind of an infection.
Yes. I'll keep that in mind next time, and I'll do better.
I really hope so. I need to see a big improvement from you next time. Okay, Aisha, it is the end of the shift, and as you know, I'm meeting with all of the students today to talk about how things went. So we're going to talk about patient-centered care, clinical judgment and critical thinking, professionalism and communication, time management and organization, and safety and infection control. Okay, so how do you feel it went today?
I think I did okay. I was nervous at first, but I got more comfortable after a while.
Good. I'm glad you got more comfortable. What went well for you?
I really enjoyed talking to my patients.
Good.
Mrs. Lewis seemed very comfortable with me, and I liked explaining things to her.
That's great. That's awesome. Was there anything that was challenging for you?
Well, we talked about how I didn't notice Mrs. Reynolds getting worse right away.
Right. That was a really good learning moment for you today, I think.
So it was.
Yeah.
I also feel like I struggled a little bit with time management. I didn't get to finish my documentation before it was time to leave the unit.
Yeah. I think, like you said, you spent a lot of time in patient rooms, and I think that was really great. I noticed that you spent a lot of time with Ms. Lopez, asking her so detailed questions about her pain, which was really, really great. But then I think you spent a little bit too much time kind of chatting, and you weren't able to complete all of your tasks.
Yes. And I also waited until the end of the day to document everything and to write everything down. And instead of doing it as I go, as we were taught.
Right.
And I didn't realize how much time it would take me to document everything, and actually like how hard it is to remember everything.
Okay. Okay. So, do you think, have you thought about any strategies that you think you could use so that this doesn't happen again?
Maybe I can write down notes right after I see each patient,
Okay.
so that I don't have to remember everything
a great idea. Let's see if we can try that next time. Okay. I did notice one other thing that I'm not sure that you noticed, but you didn't do your hand hygiene before you went into and before you left Mr. Johnson's room.
Oh, I guess I was too focused on doing my assessments and my vitals done, and I didn't even realize it until you mentioned it. Sorry.
Okay, so as you know, hand hygiene is super important for that safety and infection control piece. So this really can't happen again, and I know you know that. So what can we do next time?
Maybe I should go back to the basics. K-wipes, knock the door, introduce myself, wash my hands, provide privacy, and explain what I'm doing, and maintain safety protocols.
That sounds like a really good strategy. And don't forget, you'll also need to do your hand hygiene when you leave the room.
Okay.
Okay, Aisha, before I let you go, do you have any questions for me?
One question that I have is when we were in Mrs. Reynolds' room, when we noticed that her oxygen was dropping,
Yep.
you told me to put the oxygen on, and I was contemplating doing that because I had the thought of like I need to call the doctor before I put anything like oxygen or any intervention, but like to the patient.
Okay, yeah, that's a really good question. So you're right, you do need an order for oxygen. However, it's really important to get that oxygen up before we do anything else. And so it is okay to apply that oxygen first and then call the doctor or the provider for an order.
Okay.
And in this case, she actually did have an order for oxygen anyway, if her oxygen levels dipped below 90, so we did pray.
Okay. Thank you so much for answering that.
You're very welcome. Okay, sounds good. All right, well, good work today. I think you learned a lot,
Yes,
and
thank you.
I'm looking forward to seeing you next time.
Thank you so much.
Okay.
This was such a good learning experience.
I'm glad.